Ever found yourself just wrestling with your healthcare data? Trying to get your full medical history sent over, maybe to a new doctor,
Oh, absolutely.
and you just get buried under fragmented records, or face these really slow access times, and you're left wondering why it all feels so clunky, so expensive.
Yeah.
It's a common frustration, isn't it?
It really is. And that whole systemic challenge, that's exactly what we're digging into today. We're looking at something pretty revolutionary, actually, how
Yeah.
blockchain technology might just fundamentally transform electronic healthcare records, EHRs.
Right. So our mission for you listening is to basically pull out the key insights from a recent research paper looking at these blockchain EHR systems for what they call Healthcare 4.0.
Mm-hmm.
We want to give you a shortcut, to getting up to speed on this really cutting-edge topic.
Mm-hmm.
Okay, so to really get why this matters, let's unpack the problems with healthcare data right now. Picture this. A clinician needs your urgent history, maybe in an emergency, but they hit digital roadblocks. Different systems that just don't talk to each other. Maybe crucial data is missing, or they're waiting days for paper records to show up. It's a potential nightmare scenario, really.
Exactly. And what our source material points out is that current healthcare systems, well, they're highly complex and costly. They're really plagued by things like duplicated, mismatched records, and critically, this huge lack of interoperability.
Is everywhere.
Precisely, information gets stuck. And crucially, most of these traditional systems, they run on centralized client-server-based architectures,
Okay.
which makes them frankly quite vulnerable to security breaches and criminal activity. We're talking about really sensitive patient info addresses, telephone numbers, full names potentially getting exposed.
Wow. And I mean, it's not like healthcare hasn't evolved, right? The paper touches on this journey.
Yeah,
Healthcare 1.0 is all paper. Slow, easy to lose.
right. Ancient history now, almost.
And then 2.0, sort of early digital tracking, but maybe new privacy worries popped up. 3.0 saw more EHRs, wearables even, lots of data, but often disconnected.
Still siloed.
Exactly. And all this kind of sets the stage for Healthcare 4.0, this idea of smarter, patient-focused, truly integrated care, powered by AI, IoT, and places where blockchain comes in, isn't it? As the trusted data backbone.
That's the idea. Our source introduces blockchain as the potential game changer for this healthcare 4.0 vision. So at its heart, what is blockchain? It's a distributed, trusted, and immutable ledger.
Okay. Distributed, trusted, immutable.
Right. It removes intermediaries, and importantly, it's not dependent on centralized authorities. You could sort of think of it like a shared digital record book. Everyone involved has a copy, and once something's written down and agreed upon, it basically can't be erased or secretly changed. Super trustworthy, super transparent.
That sounds incredibly powerful, especially when you're talking about sensitive health data. But, okay, how does that specifically tackle healthcare's big issues beyond just general security?
Well, the paper details several key advantages for healthcare. First, interoperability. It argues blockchain can reform the interoperability of healthcare databases.
Okay, so breaking down those silos we mentioned.
Exactly. Imagine no more faxing records back and forth or repeating tests because the old results are lost somewhere. It allows for increased access to patient medical records, device tracking, prescription databases, and hospital assets. You get a unified view.
A single source of truth, maybe.
Potentially, yes. Second, security and privacy. Records become immutable and tamper-resistant. Every record gets a unique digital fingerprint. They mention the SHA-256 hash, like an unforgeable seal.
Right.
So any tiny change, instantly noticeable. And crucially, patients get more control. They share their identity, their data with providers using a private key. It's like their digital permission slip.
So I control who sees what.
That's the goal. And finally, efficiency. All this leads to reduced duplication of records, real-time and cost savings, and overall increased efficiency in how care is delivered.
Okay, makes sense. So in a nutshell, how does it actually work? Like a new test result comes in.
Yeah.
What happens?
Okay, so that transaction, the new result, or maybe a doctor's note, it doesn't go to one central server. Instead, it's broadcast across this secure, distributed network.
To all the relevant participants.
Right. Then, the network participants verify it using what's called a consensus protocol. Basically, everyone agrees, yes, this is legit, this is accurate.
Totally.
Once they reach that consensus, it gets hashed, given that unique digital fingerprint we talked about, and then it's cryptographically linked into this growing chain of records. An unbreakable network that, once something is committed, cannot be modified or reversed.
Locked in.
Pretty much. And the system proposed in the paper actually defines specific roles: patient, clinician, lab, and system admin.
So everyone has their place.
Yes, and they interact on a permission-based EHR sharing system. They mention using platforms like Hyperledger Fabric, which is built for these kinds of private, secure networks. So each person, each role, can only access records that they have been granted access to. Keeps it private.
This all sounds fantastic in theory, really revolutionary. But, the proof is in the pudding. Did the researchers actually test this? What did they find? Did it work in practice?
They did test it, yes. They looked at performance. And the optimization of the proposed system, as they put it, led to some pretty impressive results. They saw a 1.75x improvement in throughput, meaning the system could handle almost twice as many transactions per second. And, maybe even more importantly for a clinical setting, a 1.5x decrease in latency.
So faster access.
Much faster. Think about that clinician needing urgent info. That speed difference could be critical. They also noted that querying the transaction on the blockchain network, so looking up existing information, is much faster than writing a transaction. That's key for real-time care.
Right, read speed versus write speed.
Exactly. So ultimately, the paper suggests blockchain offers this path towards automated data collection and verification processes, which leads to correct and aggregated data that's immutable, tamper-resistant, providing secure data with a reduced probability of cybercrime. It really aims to eliminate the middleman in managing health data.
Bringing control back to the patient and their providers.
That's the core idea.
So thinking about the future then, what kind of radical new possibilities open up for, say, personalized medicine or preventative care when your entire health history is actually secure, instantly available to you and anyone you authorize, and properly integrated across the whole system? It really makes you think about how medicine could change, doesn't it?